You are an emergency department physician trained in pediatric advanced life support. You are working in the pediatric emergency department when a mother brings her 10-year-old son into the ED. The child states his heart is beating really fast. The mother denies any history of cardiac problems. She states the boy has been confused in the car ride to the hospital. Another team member takes vital signs and notes that the pulse is palpable but weak at a rate of 180 BPM. Blood pressure is 84/62 and respiratory rate is 28. You start oxygen at 100% via a non-rebreather mask. You ask the other nurse to start an IV. You attach a cardiac monitor and see this rhythm. You measure the QRS duration and note that it is 0.16 seconds. 1. You recognize this rhythm as A. Possible ventricular tachycardia, B. Probable SVT, C. Probable sinus tachycardia, D. Sinus rhythm. Correct answer, A. Possible ventricular tachycardia. The wide QRS, greater than 0.09 seconds, suggests ventricular tachycardia. You identify that the rhythm is ventricular tachycardia. The boy's blood pressure is 74/60 and he is lethargic. His pulse is still palpable at 180 BPM. 2. You determine that the child is A. Stable, B. Hemodynamically unstable, C. Ready to transfer to the pediatric unit, D. Crashing. Correct answer, B. Hemodynamically unstable. The decreasing blood pressure and altered mental status should let you know that the child is hemodynamically unstable and immediate action is required. 3. At this point you should A. Treat the hypotension, B. Perform vagal maneuvers, C. Perform synchronized cardioversion, D. Perform defibrillation. Correct answer, C. Perform synchronized cardioversion. The child is hemodynamically unstable, and you should attempt to convert the rhythm using synchronized cardioversion. Defibrillation is not indicated in tachycardia with a pulse. You immediately begin to prepare for synchronized cardioversion. Do not delay synchronized cardioversion to administer sedation to the child. 4. The correct initial dose for this child is A. 0.1 to 0.5 joules per kilogram, B. 0.5 to 1 joule per kilogram, C. 1 to 1.5 joules per kilogram, D. 2 joules per kilogram. Correct answer, B. 0.5 to 1 joule per kilogram. If the team already had the machine ready, you should not delay the cardioversion for the sedation of the child. As you watch the monitor following the synchronized cardioversion, you see this rhythm. 5. You recognize this rhythm as A. Continued ventricular tachycardia, B. Probable SVT, C. Probable sinus tachycardia, D. Sinus rhythm. Correct answer, A. Continued ventricular tachycardia. The wide QRS, greater than 0.09 seconds, rules out supraventricular tachycardia. The nurse has established an IV in the child's left arm. 6. The appropriate next step is to A. Administer adenosine. B. Ensure an adequate airway. C. Consult a pediatric intensivist. D. Deliver synchronized cardioversion. Correct answer, D. Deliver a second synchronized cardioversion. Since the first cardioversion was not successful, the team should immediately deliver a second dose. 7. The correct second energy dose for this child is A. 0.1 to 0.5 joules per kilogram. B. 0.5 to 1 joule per kilogram. C. 1 to 1.5 joules per kilogram. D. 2 joules per kilogram. Correct answer, D. 2 joules per kilogram. After the second synchronized cardioversion, you look at the monitor and see this rhythm. The child has a strong, palpable pulse with the rhythm. 8. Your next intervention is to A. Administer adenosine. B. Administer synchronized cardioversion. C. Reassess the child. D. Administer vagal maneuvers. Correct answer, C. Reassess the child. You recognize this as sinus rhythm and understand that your interventions have been successful. At this point, the best response is to utilize the Evaluate, Identify, Intervene cycle. Since you have intervened, you should now provide reassessment of the child